Hi everybody, this is Dr. Sai Haranath. I'm at Apollo Hospitals. I'm a lung specialist, and as you know, the lungs do the job of cleaning the air. You're getting oxygen into your body and then you're blowing out carbon dioxide. So why are we even talking about the lungs today? Well, you know it if you're a smoker. If you're a smoker, you probably have been coughing and you're probably been having some phlegm. So when you have a history of lung disease, you definitely should not smoke. And why is smoking bad? Do you know that one cigarette has about 5,000 chemicals in it, some of them even radioactive, and the tip of a cigarette is about 900 degrees centigrade. Imagine you're burning 5,000 chemicals at 900 degrees centigrade and you're inhaling that into your lungs. By the way, hookah is not good either. So you might have heard these stories that hookah is safer. No, it's not. There's very good data showing that Indians, especially younger people who are exposed to cigarette smoke, tobacco chewing and hookah use are putting themselves at significant risk for very bad lung disease. Now, the unfortunate thing is that cigarette smoking is addictive. The nicotine that people inhale in their cigarettes are actually more addictive than several other drugs. It's not easy to quit, but you can quit smoking. As a lung specialist, every day I see patients who really wish they did not start. Once you start smoking, you're going to have an extremely long and difficult road ahead of you. Now, one cigarette is all it takes for you to get addicted. So I would highly urge you to avoid smoking. Now, the thing with smoking is, people tell you to quit, but you need help. And we can actually offer you assistance in terms of advice on how it should be done. Now, there's something called the 5 A's of quitting smoking. You can Google that. I think you're watching this on Google, so you can Google that. So 5 A's of quitting smoking include things like assisting, advising. And of course, one of the things you need to be aware of is once you start cutting down the cigarette use, you're going to start having some withdrawal symptoms. That's because of nicotine withdrawal effects. And there are medicines which can actually control those symptoms also. So when you have an addiction to smoking, my suggestion is you set a quit date. You set a date when you say, you know what, I'm going to stop smoking. And the reason to stop smoking, you should write down. Take a white sheet of paper, take a pen of your favorite color and write down on one side why you smoke and the other side write down why you want to stop smoking. Then look at it hard and long and say, okay, is this something that's of value to me? Once you made that decision, start cutting out the unnecessary cigarettes, the ones when you wake up in the morning, the ones that you have right after eating. So cut down all those cigarettes as much as you can. If you chew tobacco, try to chew gum instead, for example. The next thing you need to do is, of course, to figure out when can you actually completely stop. And we'll continue this series, we'll talk more. So the gist of what we're talking about today is smoking, as you already know, is not a good idea. And there are multiple reasons, multiple health effects which are not good, but it can be controlled. You can quit smoking and we are here to help you. Thank you.